Good afternoon, boa tarde. Welcome to the workshop about management of bowel dysfunction following obstetric anal sphincter injury. Firstly, we would like to thank the Education Committee for accepting our workshop. And secondly, we would like to thank you for attending the workshop. I've been very lucky to collaborate with this exceptional panel in the development of this workshop, so please allow me to introduce them. Starting there, we have Rufus Cartwright, who's a research fellow working on genetics of pelvic floor dysfunction at Imperial College in London, and he has written extensively about OASIS. Next to him is Mr. Alexis Esquises. He's a colorectal surgeon at Guy's at St. Thomas's Hospital in London. His main interest is pelvic floor pathology, physiology and imaging, and he's also written about OASIS and fistula. And lastly, Heidi Brown. She's an assistant professor of urogynecology at Wisconsin, and she also works clinically, and her main research interest is the epidemiology and treatment of fecal incontinence, as well as quality of life and barriers to care seeking of women with bowel dysfunction. She has also extensively published on the epidemiology and treatment of fecal incontinence and fistula, which are two of the major consequences of OASIS. And myself, I'm a clinical specialist physiotherapist. My main clinical area is pelvic floor rehabilitation in the postpartum period, and my main research area is pelvic floor dysfunction following obstetric anal sphincter injury. We have a very tight schedule this afternoon, but just to remind you that the aim of this workshop is that you gain or update your knowledge regarding the management of OASIS, which will hopefully help you to change or update your clinical practice. For the first part of the workshop, we'll go through incidents, epidemiology, risk factors, assessment of obstetric anal sphincter injury and symptoms of OASIS following OASIS. Then we'll have a break, and then we'll talk about conservative management, long-term consequences, and then the dedicated clinic, and then that hot topic of the moment, vaginal delivery or cesarean section following OASIS. At the end, we'll actually group and discuss any questions that you might have. However, I think since we're having a very cozy workshop, please at any point, if you want to any clarification or any concepts, or you just want to start discussion, by all means, please do so. So with no further delay, let's start.